Well, a warm welcome to today's talk. It's still Thursday, the 27th of January. Now, I want to look at some data that shows some interesting trends that are happening. And again, these apply globally, so this applies all over the world, this information. Here we see the hospitalizations in South Africa. And this is what an Omicron wave looks like. So shall we count there? 1, 2, 3, 4, 5, 6, 7, 8. 8 or 9 weeks. And now the hospitalizations are down dramatically in South Africa. And in fact, if we look at the current situation there, we see that. So quite incredible here. We've got 5,800 patients in hospital. And most of those are in critical facilities. And the amount of patients on oxygen in the whole country of 60 million people is 708 people on oxygen in South Africa who've been diagnosed with SARS coronavirus 2 COVID disease. So really quite incredible. Now, some interesting things happening in the States. Let's just have a quick look at that now. So here we have the United States. Now here we have the trend in daily number of cases. There's no question that the number of cases are going down. But I am expecting them to blip up. And you probably know why I'm expecting them to blip up for a short period of time at least. And that's because the BA.2 variant will become predominant in the United States in the next few weeks, I believe. And that's 50% more transmissible. So there will be an uptick for a short period of time. I don't believe there's more people going to get sick or hospitalised or die. I think this Omicron, this BA.2, is an Omicron, the same as BA.1. But it is more contagious, 50% more contagious. So that could well cause an uptick in cases in the States. Sad to see that the number of deaths in the States are still so high. That's on that graph there. And the explanations for this really aren't very satisfactory at the moment. We do know there's a lot of comorbidities, but we do need more explanation really from the US authorities on that. Now this one here is hospital admissions, and we do see it going down slightly. But of course with the BA.2, that could actually go up a little bit, albeit for a short period of time. And that's the number of people in hospital now, which we can clearly see there is a downward trend in the United States, but higher than it's ever been. Now, why the hospitalizations are so high in the States, we really do need some more explanation for this, because the explanations so far aren't adequate. I mean, we know that there's more comorbidities, an older demographic in the population, but not really so much more than the UK, although there is more comorbidities. We know that vaccination rates are somewhat lower in the States, but there's got to be more to it than that. It's not just those three ideas. We really need more explanation than this from the CDC or somewhere as to why the death rate in the States has remained as high as it has, and on an ongoing basis it's always been higher. So that was the United States. Now let's look at some UK data now as well. Just summary data from the UK. People testing positive down and flattening out. There could be a slight uptick on that. In fact, I think there will be a slight uptick on that because the BA.2 is going to take over shortly. This is patients admitted to hospital, which is going down. Again, that could go up slightly for a short period of time because of the BA.2 effect. Not because it's making people sicker, just because there's going to be more people contracting the virus all at the same time. Deaths within 28 days of a positive diagnosis. Roughly flat in the UK, down a little bit, but roughly flat in the UK. So that's just background data from the UK. Now I want to go now and look at the Office for National Statistics, which gives really good definitive data, just a bit late. Prevalence for the week ending the 22nd of January. Well, just over 2.5 million people in England had the virus, 1 in 20. Wales 1 in 30. Scotland 1 in 30. Northern Ireland 1 in 20. It is good to have these slower because it sort of spreads out the hospitalisation rate to some extent, but it's burning through the entire population. Doubly vaccinated, less likely to report long COVID. Now this is important. So compared with the unvaccinated people when they're infected, 41% less likelihood of developing long COVID at 12 weeks. Now the proviso here well, clearly we can see that double vaccination is reducing the incidence of long COVID. I think that's pretty clear from this large-scale ONS data. But of course, this data was collected in the time of Delta. So the long COVIDs we're getting now were collected in the original wave, the Alpha wave, or the Delta wave. Doesn't tell us what's going to happen in the Omicron wave. So it tells us what's happened in the past. So we can say that double vaccination, if you've had Delta, for example, is giving a 41% protection against hospitalisation. It doesn't tell us about the level of protection against Omicron. Now, I'm actually expecting less long COVID with Omicron, but we don't know this yet. The data is not there. It could turn out that there's more long COVID with Omicron. I really don't think so, because the infection is largely in the mucosal compartment, as Professor Clancy explained recently. So I'm expecting less long COVID, but until the data's in, we don't actually know for sure. Risk of COVID-19 deaths higher for most ethnic minority groups. Now, this really is quite a sad reflection. So if we take, for example, the Bangladeshi group in the UK, women 5.2 times more likely to die than the equivalent white British women. Men 4.4 times more likely to die, not percent. So they're 5 times more likely to die. They're 4.5 times more likely to die. This is massive, and it really is incredible. We mentioned the role of vitamin D being produced more slowly in people with darker coloured skins, and this is not an exaggeration. On this channel we were talking about this quite clearly in January 2020. It's a full 2 years ago, and this has not been acted on, and really it's why hasn't it been acted on? It's just tragic that these are probably unnecessary deaths. Now, still on the Office for National Statistics, here's their review here. So percentage testing positive for COVID-19, positivity going down, but still there quite a bit below the epidemic threshold theoretically, but that's rather a theoretical consideration. Hospital admissions are going down a bit, which is good, but as we've said, this will probably go up a little with BA.2. This could probably go up a bit after that with BA.2. Deaths, likewise, I expect them to go down over the next week or two, following the trend of cases, even though the proportion of deaths is now much less compared to the number of cases with Omicron than it was with Delta. But this could go down and then go up a little bit as the BA.2 kicks in all of a sudden. I don't think it will mean that more people die overall, but it means that the deaths could come in a shorter period of time because the infection is going through the population in a shorter period of time. So 78.6% of adults have had 3 doses of vaccine in the UK. Fine. This is going to protect against future infection and hospitalisation, at least for a period of time. And we know that 2 doses of vaccine protects against hospitalisation equally well as having had the natural infection, whether or not you've been vaccinated. How 3 doses of vaccine is going to compare with having had the natural infection, of course, we don't yet know. But we do know from the data in the States, from New York and California, that people that have had the natural infection are as protected against hospitalisation as people that have had 2 doses of vaccine. So interesting to see how that will go with 3. I haven't seen any data on that so far, and have been looking, but I haven't seen it yet. We will keep an eagle eye out for that. Well, look at that. 98% of adults have got antibodies, either from natural infection or mostly from vaccination. And social distancing has been going up on a variety of measures slightly recently as well, as people basically become cognizant of the Omicron wave, I believe. Positivity in England has gone down. So the percentage of people testing positive has gone down. As we say, that could go up again in the next week because of BA.2 or the next 2 weeks. Scotland, it's gone down slightly as well. Estimated, what's this? I can't remember what that one is. We'll skip that one. This is what happens if you don't put the key on the top. We'll do that one tomorrow. Now this is the deaths. So here we see Bangladeshi men, black African men, black Caribbean men, Chinese, actually see them having less. So the same death rate is there. And we see that here it's 4 and 5 times the death rate in the Pakistani group, and 3.5 times the death. So sorry, about 4.5 times the death rate in the Bangladeshi group, about 3.5 times the death rate in the Pakistani group. Really quite sad that this has not been addressed. They're the figures for men, and they're the figures for women. So again, unfortunately, we're seeing higher death rates in these ethnicities, most of whom have darker coloured skin, therefore will produce vitamin D more slowly. Probably something about the Chinese diet, perhaps eating fermented foods or something, that means that their death rate is slightly less. We can't explain that, but we do know that Chinese men here in this case are dying slightly less than white British men. Now, we've talked quite a bit about comorbidities and people dying with only COVID-19 on the death certificate, and this puts this in proportion. Now, it's funny, whenever I say something like there's only 17.5, well, only, there's been 17,500 deaths. I mean, it is only compared to the 160,000 or whatever it is altogether. But when I say there's been 17,500 deaths where COVID was the only cause of death on the death certificate, of course, people have jumped on this to try and support their idea that COVID is not as deadly as we think it is. Another group of people have jumped on this to say that I'm spreading misinformation, which I was certainly not, wasn't aware of doing. So let's put that into context to try and clarify this. So here we have, these are people that where the COVID-19 has appeared on the death certificate. Now here's the proportion of people with COVID-19 on the death certificate without comorbidities mentioned. And we see, as we said at the time, as we clearly said at the time, the vast majority of people do have comorbidities. And diabetes is the most common. And we saw from the Ugandan doctors this morning that obesity was the most common in Uganda, and it's diabetes here as we see in the UK. But of course, a lot of people, the majority of people with diabetes, the vast majority of cases, something like 90% of diabetes in the UK is type 2. And the majority of people with type 2 diabetes do have obesity. Not all, but the majority. So it does make sense. So diabetes, chronic respiratory diseases like bronchitis and emphysema, high blood pressure diseases of the urinary system, ischemic heart disease, all these comorbidities we've known about for a good 18 months now. People with generally ill-defined chronic ill health, dementia and Alzheimer's disease, heart failure, cardiac, that should be called dysrhythmias really, but they're calling it arrhythmias, where that rhythm of the heart is abnormal. Malignant diseases, and finally with no pre-existing disease. So there's no question that these people here with diabetes or whatever it is would have gone on to live for years or decades more had they not had COVID-19. So it's interesting how many people have almost sought deliberately to misunderstand what we were saying there, but I hope that clarifies. Hope that clarifies that situation. Now let's go on and look at Tim Spector's Zoe study data. This is always the most bang up to date, of course. So symptomatic cases, nearly 160,000 cases. Now this was actually today. This is today's data, 27th of January, up 10% from last week. So it's gone up on the most recent data. Definitely gone up. This is why I've been predicting that the official figures will also go up, because they nearly always follow the COVID symptom tracker data. People become symptomatic usually before they test positive, and there's time for those tests to get through onto the official statistics, which are always somewhat delayed, of course. We'll come on to that in a minute. R value in the UK gone up. It was about 0.9, now it's about 1 again. Prevalence-wise, 1 in 30 people in the UK have symptomatic COVID. And we'll see what Tim Spector says in a minute. We'll just look at these graphics first, I think. So here we have new cases. So it was going, of course, it was going up. That was the Omicron wave. Then it went down. And then it's going up slightly. Now, the reason it's going up slightly is the BA.2 variant, which is 50% more contagious. And, of course, I think we have to assume it's the return to school effect. So it's 3 weeks since young children and, well, anyone up to the age of 18 went back to school. And now we're seeing this effect filter through. as we always have done indeed. Whenever schools have gone back, we always get this slight uptick. But here we've got the double whammy with the new variant as well. Now, this is total number of new cases, symptomatic cases. This is in the fully vaccinated, and this is in everyone. Now, this blue line here is not people that are not vaccinated, it's in everyone, so it includes this line here as well. But what we're seeing is clearly people that are fully vaccinated with 2 doses of vaccine are often getting symptomatic disease, and that is starting to tick up again as BA.2 and the schools going back starts to affect. And we see it's mirrored exactly there, or reflected exactly there in people that are, in all people, as well, the vaccinated and the unvaccinated. Now, this is the cases by region. Now, we had expected all the regions to go up as high as London. That hasn't happened, presumably because there's slightly less vaccination in London and because there's slightly lower vitamin D levels. But they all went down, and now they are upticking again slightly. And this, as we said, will be reflected on the official data pretty soon, although it's not there yet. And then the week after that, after it's been reflected on the official data, the week after that, it'll be reflected in the Office for National Statistics. So this is what we have. We have the Zoe COVID symptom tracker data first, then we have the official government data, then we have the definitive Office for National Statistics data. That's the way we get our data, the way it goes. So that's the regional data. Now, this is age group. Now, of course, this is the 0 to 18 here. And we do see this big return to school effect. So that's definitely part of it, as well as the BA.2. And then the other uptick here is the green one. That's the 35 to 55, which of course is the parents. So this blue line have been taking it home to this green line as the children take it home to their the children take it home to their parents, as we would expect, and as we've seen. Again, we've seen this repeatedly. Now, this is people with common cold type symptoms, instance of common cold like symptoms. So we did see this period of time here where people with COVID, most common cold symptoms in the country were actually caused by COVID, because the orange line is common cold symptoms caused by other respiratory viruses, and this is the COVID one. So now we see that most common cold symptoms in the UK are caused by other respiratory viruses. We also see that the COVID virus is causing, the SARS coronavirus 2 is causing a lot of common cold type of features. And I think it's always good just to remind ourselves of the common clinical features. These are the most common. I'm not going to run through them all. We've done it before. I will post them again. But runny nose, headache, fatigue, sneezing, sore throat, persistent cough, hoarse voice. All the common cold type features there are really quite well, they're common, but of course these are not caused by common cold. These are all symptomatic cases of COVID-19. Now let's see what Tim Spector says here. End of school holidays repeated. Yeah, okay. End of school effect is causing a rapid rise in children taking it up to the parents. But a new subtype of Omicron, the BA.2, is also taking over. So Tim Spector clearly says it's taken over. Last week it was 1 in 20 new cases. It's doubling every few days, probably every 4 days. The BA.2, BA.2, the cases are doubling every 4 days, so it's soon going to take over. And Tim Spector's clearly saying this should predominate within a month. And if it's happening in the UK, this is going to be happening in the United States and in Canada and everywhere. BA.2 Omicron is going to take over from BA.1 Omicron. So the same way Delta displaced Alpha, the same way that Omicron displaced Delta, now Omicron is displacing Omicron. But it's the BA.2 Omicron displacing the BA.1 Omicron. It's still Omicron, and we're pretty sure it's got the same level of pathogenicity. It's just a bit more contagious. So that means we're going to get herd immunity all the quicker, but it does mean there's going to be pressure on hospitals as well over a shorter period of time than we would have liked. Natural infection with Delta may not offer much protection against Omicron. Indeed, it doesn't. But we know that Omicron offers good levels of protection against Delta, which is one of the reasons that Delta has essentially become extinct, because people that have had Omicron, if they're exposed to Delta, they won't get it because they have this back immunity. The Omicron exposure causes Delta immunity, which really couldn't be any better. It really is quite good news from that perspective. I expect cases will stay high until the spring. Okay, depends when spring starts. So Professor Spector giving himself a bit of leeway there. I suspect till, well, the thing is with the BA.2, it's going to run through much quicker. So cases will still be high into February. But by the end of February, most people will have been exposed to BA.2 Omicron, and cases should start going down fairly dramatically then by about March, I would expect. So it depends what we call spring. Most vaccinated infections are mild, symptoms lasting over a shorter period of time than Delta, less severe cases, and we are, of course, Tim Spector and myself are both still worried about the vulnerable groups, because they are going to be exposed to Omicron just the same as everyone else is. And we did see on recent data from the Office for National Statistics that even people that are guarding are still getting Omicron infections at almost, not quite, but almost the same rate as everyone else. So there we go. Wherever you are, the BA.2 Omicron is taking over from the BA.1 Omicron, but remember, it is still an Omicron. So a bit of a data blitz there. So if you've stayed with that, thank you for watching. And yeah, that's all I want to say, really. So thank you for watching.